Hello everyone, welcome to my lecture. This is Dr. Jerry Cowart. Today we're going to be speaking on allergies. I'm allergic to everything. In this lecture we'll talk about what are allergic reactions, some common allergens, and different organ systems that can be affecting it, and how we would naturally treat these allergens. So first I want to start off by talking about the elephant in the room, which is COVID-19, and talking about what it is and what it isn't real briefly. So the main highlights is if you have a fever over 100 degrees Fahrenheit, if you have a dry cough, a dry unproductive cough, and you have shortness of breath, those are the three main hallmark signs of COVID-19, and at that point you should probably seek out your healthcare provider to get tested for that. Yes, allergies can cause a fever, but typically it would be slightly elevated, like maybe like a 99.2 or so. But if you've got anything that's over 100, that would be more closer to maybe like a COVID-19 in this scenario. With allergies, you would typically see sneezing, runny eyes, or itchy eyes and runny noses, which you wouldn't necessarily see with COVID-19. So if you see the extremely high fever or the dry unproductive cough, the shortness of breath, that's when you need to seek the medical intervention. If not, if you are experiencing any of these other symptoms, that it could be allergies and you should come see us instead. Okay, so now that we have that out of the way, let's talk about the 7 signs of stress. So if you're experiencing headaches, fatigue, any kind of tension or pain within the body, any kind of sleep disturbances where you're waking up or it's hard to go to sleep, any irritability or mood swings, maybe some digestive issues like constipation or diarrhea, and our topic of today, allergies. If you're experiencing any of these 7 signs of stress, chiropractic and natural holistic health care can be the right mode of health care for you. And today, obviously, we're going to be touching on the allergies specifically. So let's start off by talking about some statistics in the United States in regards to allergies. Roughly 10 to 30% of adults in the United States suffer from allergies per year, and that number actually goes up to about 40% when we're talking about children. It's the 6th leading cause of chronic illness within the United States, which is kind of interesting if you think about all the different chronic disease processes that people typically go to the hospitals for, and the fact that it's still one of the leading causes that would cause illness. The 3 most common allergies that people deal with are medications, followed by foods, followed by insect stings. And medications is considered the most allergy-related deaths in the United States, which baffles my mind every time I think about it. Your most common demographics that's going to be affected with allergies every year is going to be your African American populations and your elderly populations. I think the main reason for that is specifically vitamin D levels, and we'll talk a little bit more at the end. But basically, vitamin D levels are going to be super important in boosting immune system and fighting off allergies. And in those 2 particular demographics, we typically see a decrease in vitamin D levels within those populations due to basically decrease in sunlight absorption, whether it be because of the dark skin or the sedentary lifestyle of the elderly who don't get outside and as much exposure to the sunlight as the other demographics would. So we talk about people having allergies. So what is an allergic reaction? So basically it's when a foreign body enters the body, whether that foreign body being some sort of pathogen like bacterial, viral, or whatever, or it being an actual allergy like a food that you shouldn't be eating, or pollen, or any of those types of allergies. When they enter into the body, your immune system kind of mistakes it for something that's harmful and tries to protect itself. So it's going to overreact and and you're going to end up getting these inflammation patterns, and that's ultimately that allergic reaction that you experience. Now, your body does identify what these allergies are and create specific antibodies called immunoglobulins. And the end result of that whole cascade, and we'll talk about it a little bit further, is basically histamine, which is going to be that pro-allergic reaction molecule that's going to spark the allergic reactions, whether it be the runny nose, the itchy eyes, the red itchy skin. The histamine is going to be basically the causing factor of all of those things. So some of these common allergens are foods is a huge one for a lot of people. This list here, the top three, peanuts being the number one most common food allergy that people suffer from. Secondly would be dairy. And then the third most common food allergies would be your shrimp or your shellfish. And then you see here other things on the list being your wheat grains and glutens for those people with gut sensitivities. Nightshades is another huge one. Those potatoes, tomatoes, and peppers, those are going to be very pro-inflammatory, meaning they're going to cause a lot of inflammation within the body. Other allergens being your pollens and molds, which is huge within the seasonal allergy category. Pet dander is another one that people either forget to think about or choose to ignore because of their loved ones being their pets. Obviously, insect bites or stings is another huge one, and we already talked about the allergic reactions from medications as well. Okay, so you might be thinking, why do we get allergies? Why sometimes you get them any at all, or sometimes why, while you're younger you didn't get allergies, but as you got older you do have these allergies all of a sudden, or why someone next to you doesn't get allergies, but you do. Overall, why someone has allergies or allergic reaction, part of it is a normal defense mechanism within your immune system. So sometimes those allergies are negative foreign bodies into the body, and your body does need to get rid of those and respond to it appropriately. But if you are constantly re-exposing yourself, meaning you're constantly eating foods that you're allergic to, or you're constantly being in outdoor environments where the pollen's super strong, or we talked about pet dander, eventually it'll have a total body burden where it's constantly having to fight off these allergies over and over and over again, and eventually that's when you can get that overreaction like we talked about, and that's when you start getting the huge symptomatology of a lot of these allergic reactions, where you start having skin changes and skin reactions, or the constant itchy eyes, or the constant digestive problems. And again, we'll talk about further specific organ systems that relate with this, but with the immune and the adrenal dysfunction really closely related to each other, that constant aggravation of, or constant introduction of those allergies will eventually wear out your adrenal system, which is your stress glands. And then you'll start getting adrenal fatigue with this, which eventually will total body kind of shut down. Sometimes you will get allergies later in life due to hormonal changes. So sometimes it's really common, a female after pregnancy, or maybe after their first pregnancy, they were never allergic to something beforehand, but after the pregnancy they are. And that would be due to overall hormonal changes, because again, a lot of these allergic reactions are biochemical in nature. Sometimes that also happens after puberty, so that's why a lot of times you can see teenagers with acne that came on out of nowhere, or vice versa. And so that's why sometimes someone gets allergies and someone doesn't. So when we're talking about someone having an allergic reaction, it is important to understand some of the how it happens. When we're talking about an allergic reaction, it is an immune response at the end of the day. And your immune system produces antibodies that fight against certain foreign bodies that enter in your body. When we're dealing with allergic reaction, that foreign body is what's called an allergen, basically an allergy that your body does not like. So when we're talking about antibodies, the main antibody that your body does produce to fight off against those allergens, those allergies, would be the IgE, which is in the middle of this slide here. It says parasites and allergies. So these antibodies are blood proteins that are made by your immune cells that fight off against specific antigens. Antigens are those foreign bodies that I mentioned. So the specific antigen that the IgE will fight off against are those allergies, those allergens. So how exactly does the IgEs help fight against those allergies? So when an allergen enters the body, and for this case, we're going to call the allergen in question pollen, okay? So when pollen enters the body, it's going to attach to the B cell and produce the IgE that will then recognize pollen. So that IgE is now responsible for pollen. Then that new IgE that now recognizes pollen will attach itself to a mast cell, which again is another immune cell. Now, the second time you get re-exposed to, quote, pollen, that IgE that identifies pollen that's attached to that mast cell will then signal the release from that mast cell the histamine. Histamine is that big key player that is going to cause the allergic reaction. It will cause the inflammation. It will cause the itchiness of the eyes. It will cause the runny nose. It will cause the redness and itchiness of the skin and the irritation of the gut with the digestive disorders. That histamine is going to be that initiator of the allergic reaction. And then in turn, that's when you end up starting to get all those allergy symptoms that we identified already. So as you can tell by the variety of symptoms that allergies can create, it's pretty obvious to see that allergic reactions have an effect on many different organ systems within the body. When we talk about lungs, that's mainly when we have someone who's got asthma, so that would be the constriction of the alveoli, the air sacs in the lungs. With the esophagus, you hear someone eat shrimp and their throat swells. That's going to be dealing with the esophagus, that constriction of the airway. And then you also have skin. You have the itchiness and redness on the skin, or the welt from a bee sting. And the skin, a lot of people forget, is truly an organ. It's actually your body's largest organ, and it's a protective organ. And it's usually your body's last line of defense, or sometimes it's your first line of defense. And a lot of times if your body is trying to get rid of something, whether it be like an allergen, it will try to bring it out through the skin, and that's why sometimes you'll see the redness or the itchiness in the skin. These other 4 organ systems that I have listed, the brain, gut, bladder, and adrenals, I'm going to break those down a little bit more specifically, because with those particular organ systems, a lot of people don't think about those when dealing with allergies like they would with the lungs or the skin or the esophagus. So I want to bring a little bit light to some of those organ systems to show, how widespread allergies can really be for someone. And so when dealing with the other organ systems, I think one of the biggest ones for me that comes to mind would be the adrenals, because the adrenals do truly have a huge widespread effect on all the other organ systems as well. When you are constantly being bombarded by allergies, whether it be food allergies or pollen or any of the other types of allergies, it will constantly put stress onto the body. We talked about the 7 signs of stress. when you're constantly being bombarded with those allergens and you're constantly stressing out your body, that's basically your adrenal glands that you're stressing out. Your adrenal glands are your stress glands that produces the stress hormone cortisol. Cortisol does help in basically being a blanket for inflammation. So if you think, something's on fire, you try to smother it. That's kind of what cortisol does in a sense, if you kind of put it basically. And as you're constantly stressing out your adrenal glands, and you're constantly having to produce more and more and more of that cortisol to help put out the fires, basically, those adrenal glands will eventually tap out on you and just fatigue. And when you have the adrenals fatiguing out, that's when you start seeing breakdown of a lot of other organ systems, in relationship to like the kidneys and blood sugar regulation and brain function. All have a huge impact from what the adrenal glands do because of all the different feedback mechanisms built in with the adrenals. So if you're going to have a constant increase in inflammation, you're going to have a constant increase in adrenal activity, but then eventually you'll go in the opposite direction where the adrenal glands will eventually just kind of give out on you. And then that's when other issues start to occur. So within our realm, and we'll talk about a little bit further about how we would treat stuff like this. In our realm, when we're dealing with adrenal fatigue or with allergies, sometimes people want to play chicken or the egg. And in this case, oftentimes adrenal glands are kind of secondary to allergies, so you want to take care of the allergies to help with the adrenal fatigue, and that can help alleviate the allergic reactions and also help boost up adrenal function as well. So another organ system that can be affected by allergies is your bladder. Specifically, the allergies that we're talking about are really food allergies in this case. A condition that we're kind of talking about here is called interstitial cystitis, and that's basically just inflammation of the inner linings of the bladder. So you are going to, with this IC condition, interstitial cystitis, a lot of S's there, you're going to get the inflammation, you're going to get pain, sometimes with it, but the main thing is going to be frequent urination. Hence the picture there. So this patient that we're talking about is someone who you would deem as the person with the world's smallest bladder, or the bladder size of a peanut. That person who has to plan their entire day around where is there going to be a convenient bathroom, or someone who limits their water or fluid intake because of being afraid of having to urinate too much. And oftentimes we see that in this particular case, if it truly is interstitial cystitis, it's being caused by specific food allergies to that person that is causing that inflammatory pattern within the bladder that's making those symptomatologies worse. Some common foods that would be affecting the bladder this way would be your acidic foods. A lot of times it's like the citrus, like lemon and grapefruit. And some other foods could be like your spicy foods, like your peppers and your curry and different spices like that. And then also artificial sweeteners. So that's going to be things like saccharin and aspartame. Those will all be allergens or allergies that would negatively affect the bladder that can be causing, frequent urination. And, this will be important to distinguish between other issues that would cause the frequent urination, stuff like type 2 diabetes or any kind of prostate issues. Those could also cause a frequent urination. So we would want to look at allergies too as a differential to see, well, maybe it's an allergic reaction, so to speak, that could be causing this frequent urination within certain patients. And so here's another organ system that is commonly affected by allergies. I think it's becoming more and more common understanding that a lot of digestive issues are kind of allergy based. A lot of people kind of don't see it that way, because when people think of allergies, they think of the typical like pollen, so they're going to be like sneezing and the watery, itchy eyes. So, but nowadays a lot more people are starting to realize that irritable bowel is really coming from food allergies that are negatively impacting the intestinal tract. With irritable bowel syndrome, unfortunately, it's a disease that's really diagnosed based off of symptoms. Those symptoms would be including pain, like abdominal pain, bloating, gas, and then the interesting part is that you can have either diarrhea or constipation. The diarrhea would be from the impermeable gut and some of the fluid retention coming from the adrenals. You could have the watery, runny stool because of the increased inflammation within the gut, making that gut permeable. So you're not digesting things as easily. And then you can also have constipation due to that pro-inflammatory molecule known as histamine that we talked about. Histamine does cause muscle contractions. So you do have those smooth muscles around the intestinal tract that contract and relax over and over again, and that is what causes the motility within that gut. So if you're having constant contractions because of the constant exposure to the histamine and other inflammatory processes, you're going to have that constipation because you're not going to be able to continue to move the contents out of the colon with that constant contraction. The problem with treating something like irritable bowel in the medical realm is that obviously you would want to figure out what the allergens are, but the traditional testing, which we are going to talk about towards the end of this lecture, their typical testing that they would use, like the skin prick test or the like blood test, won't really show specific allergens or allergies that would be affecting the colon, because the skin prick will really only show what allergy reactions happen on the skin. And with that and the skin prick and the blood testing, there's a lot of room for error. There was one article that was posted that says about 40% inaccurate, whether it be not showing everything that you're allergic to or showing some false positives that say that you may have some sort of antibody for, but you're not really dealing with an allergic reaction for those things. And so outside of just purely eliminating certain foods out of your diet and see if that helps the symptoms of irritable bowel, that's about all the medical realm at least has to offer on figuring out specifically which allergens are affecting the bowel in this case. So continuing on with the conversation of the intestinal tract with allergies, I want to touch base on the relationship between the gut and the brain. So as we can see, allergies definitely have a negative impact on overall gut health. And what we see is that the gut and the brain have a huge relationship to each other. So whatever happens in the gut can easily affect the brain. There's about just as many nerve endings in the gut as there are in the brain, so there's a huge relationship between the two. And there is a certain nerve called the vagus nerve that originates in the brain and does travel throughout the body, touching all the different organ systems, including the intestinal tract. So there's that constant feedback loop of what's going on in the intestinal tract and what's going on in the brain. So when we're talking about allergies, if we've got certain allergies going on in the intestinal tract, because of that relationship with the brain, we see that a lot of allergies in the gut can be causative factors for a lot of emotional or psychological issues. And we're talking things like ADHD, OCD, anxiety, depression, and this is really common in the kids or the teens or the early adults. It's super huge, and there's a lot of correlations, and we see a lot of gut allergies that are affecting the brain in this matter. So oftentimes, if you're trying to heal those emotional and psychological issues, you oftentimes end up having to heal the gut in order to heal the brain. So you see that a lot, unfortunately. So we have gone through and figured out, what is an allergic reaction, how it affects the body. So now we got to figure out, what am I allergic to that could be causing this? How do we find out what I'm allergic to? So conventionally in the medical realm, there's a few different tests that they do for allergy testing. The first one being the RAST test. That's that skin prick test that you see in that first picture. They basically prick your skin with a whole bunch of different known allergens to see if you get some sort of reaction to it. Some of the reactions you can see in the photo is the redness of the skin, some welts that form on the skin, and sometimes you don't get any reactions at all. And then you have, like an elimination test, which would be like an elimination diet where, you remove certain foods out of your diet and see if it improves your symptomatology or not. And then you also have blood testing to check to see if you have certain antibodies in your bloodstream for certain antigens, and it would give you an idea, supposedly, what you may or may not be allergic to. Unfortunately, there's a lot of studies out there that actually shows the inaccuracy of a lot of these tests. And the inaccuracy could be where it's not showing all of the allergens that you may be allergic to, or it may be showing up some false positives because there could be some free-floating antibodies that's going on in the blood that you may not truly be allergic to, where you just may have came in contact with once. So unfortunately, a lot of these tests do yield in a lot of inconclusive results by the end of the day. And then some of the conventional treatments of these allergies, again, this is going in the conventional medical realm. You have different medications like your antihistamines, similar to Benadryl. Again, that's going to mainly affect the end of that whole allergic cascade, as opposed to preventing the allergic reaction cascade from starting to begin with. This would just block the reaction of those histamines causing the allergic reaction part of it, but it never fixes what truly the allergen was to begin with. Again, the nasal decongestants, that's just going to be symptom relief as well. Same with the anti-inflammatory steroids. Again, that's going to be at the tail end of the cascade versus at the beginning, which is what we want to do. The best thing that I see on this list is really the avoidance, because that's going to avoid the initial allergen to begin with, which would stop the initial whole allergy reaction cascade from even beginning. And that's going to be your best method of preventing these allergies from occurring and halting these allergies from occurring. But with those conventional ways of dealing with allergies, they're really only looking at the actual allergic reaction themselves and targeting and treating certain aspects of those allergic reactions. Here in Roselle Center for Healing and within the natural holistic healthcare realm, we don't target the allergy per se, as we target the whole person as a total person and help many different organ systems all at once versus just targeting one individual thing. So you see here we operate basically off the Triad of health and the 5 factors. The Triad of health is that triangle in the middle where we talk about really only 3 things in life can cause anything in the body, and that's dealing with your structural or injury patterns, your biochemistry within the body, or emotional stress within the body. And those 3 factors, or I'm sorry, those 3 facets of someone's body gets affected by 5 main factors. The top being your nervous system, because obviously your nervous system controls every aspect of your body and tells different organ systems what to do. And you also have lymphatics in your blood system. Your lymphatics is going to take out waste. Your vascular system is going to transport all the appropriate nutrients that it needs. Your cerebral spinal fluid is going to be kind of a combination of both of those for specifically your nervous system. And then your acupuncture is the overall, I kind of call it the glue of the body. It's how every organ system in the body is interconnected and how they feed into each other and how all the inner workings of the body correlate and work in harmony together. So we always want to make sure that that whole triad of health is intact, and those 5 factors are all doing what they need to be doing to help that overall triad of health, because we don't want that triad of health to turn into a triad of disease, because that's ultimately when you start getting different symptomatology, i.e. allergic reactions. So, as the natural holistic healthcare is concerned with dealing with allergies, like I mentioned, we're going to be looking at the total body. So, we're going to be looking from start to finish of whatever the process that is happening, in this case, an allergic reaction. So, how we would end up identifying and treating these allergies is first we got to identify what the actual allergen is. So previously we talked about the conventional types of allergy testing within applied kinesiology, which we specialize here at Roselle Center for Healing. We use what's called neuromuscular testing, which is a manual muscle testing. It's what I would consider like a binary computer system where you have an input in and an output out, and you either get like a yes, no, a good, a bad, a facilitated muscle, or an inhibited muscle. So what we can do is we can introduce certain allergens to the body and do the manual muscle testing to see if the muscle stays facilitated or if the muscle inhibits due to that allergy, to see if that allergy or that antigen is good for the body or not good for the body. Does your body handle this well or does it not handle it well? So we can use a series of those manual muscle testing, that neuromuscular testing, to really go in and identify which allergies or which substances can negatively affect the body. And at that point, we would try to remove those out of your system, whether it be very guided dietary regime or whatever the case may be. And going with that, we would then create an individualized treatment plan for that individual. Oftentimes when we're dealing with someone with allergies, it's usually advantageous to utilize chiropractic, acupuncture, and nutrition. Sometimes it's some combination of the three. Sometimes it is all three. Chiropractic main claim to fame is really addressing the nervous system, making sure that nervous system is firing as optimally as possible, because again, we talked about how the nervous system really controls every part of the body. So as long as we are utilizing chiropractic care and removing any of the interference out of the nervous system to allow it to work optimally, you're really going to be able to address these allergic reactions effectively. And then also, with acupuncture, we talked about how it's that glue, it's that overall energetics of the body, how all the different organ systems work together in harmony. And as we talked about before, allergies really do have a full body effect, or definitely can have a full body effect. So you really want to make sure that all your different organ systems are firing as optimally as possible. And acupuncture really does help with that. And then you also have nutrition. If we're dealing with an allergy that is food-based, your food allergies, you really want to make sure that you have good guidance from a clinical functional nutritionist that can help guide you in the appropriate ways to avoid certain allergens within your diet, to make sure that you're not constantly re-insulting your body with foods that aren't appropriate for you. And as you can tell, with utilizing the chiropractic and the acupuncture and the nutrition, it would be a multi-step approach to balancing the entire body, because it's not just one thing that's going to cure all with this. It's going to be a multidisciplinary approach oftentimes, because you have so many different body systems that can be affected by allergies. And sometimes, one of the things that we end up doing outside of the office is coaching you on certain lifestyle changes, whether it be, changing your diet, the way you eat, whether it be You may have to change your at-home environment, where you may have to do like get a new bed if there's dust, or maybe the type of pet that you have in your house, or maybe it's a geographic location if we are talking about your molds or pollens, because sometimes molds can be in your house, so you may have to relocate. And then obviously the earlier you can identify the allergens that affect you negatively, the better off you are at combating them. So if you know you've got seasonal allergies that really affect you, coming in to get evaluated and get treated like in the fall or in the winter before allergy season approaches, you'll have a much better effect of fighting off those seasonal allergies than you would have initially trying to treat it after the fact. So when we're looking at the chiropractic side of how to treat allergies, there are definitely some structural patterns that arise that are really common with allergy reactions and allergy patterns that would be very imperative for chiropractors to be able to identify, evaluate, and address. One of the main ones would be what we call a temporal bulge. It deals with that temporal bone of the skull, and that's what's highlighted in green there for you on the skull. That bone is really closely related to that vagus nerve that I mentioned earlier that wanders throughout the body and that helps innervate a lot of different organ systems, including your intestinal tract. So when we have a misalignment or derangement within that temporal bone, it will in turn have a negative effect on that vagus nerve and obviously the rest of the nervous system. So we want to make sure that we are addressing that cranial bone, that temporal bone, right out of the gate when we're dealing with an allergy pattern. Another structural pattern, it can be some shoulder issues, specifically dealing with the pectoralis major muscle. That pec muscle is a shoulder stabilizer, so if there's some sort of issue with that muscle, there can also be some shoulder dysfunction. That muscle, specifically the upper portion, that clavicular portion of that muscle, relates to the stomach. So in applied kinesiology, we do see muscle and organ relationships oftentimes, and with this particular muscle, like I said, relates to the stomach. In the next slide, we'll talk about some biochemistry that can affect allergies. And one of the things on there is hydrochloric acid, which is your stomach acid. So not enough stomach acid can also lead to allergic reactions because it's not going to be able to break down the protein structure of those allergens to help your body deal with the allergies more effectively. So if you're not producing enough stomach acid, there could be something going on with the stomach, which in turn can reflect into the shoulder, causing some shoulder issues. We talk about pelvic dysfunction here because with a lot of the bones in the body, they have what's called a brother, basically an opposite bone, a bone in the opposite part of the body that relates or kind of works similarly to each other. And so when we're dealing with any of the bones in the skull, similar to the temporal bone, those bone brothers, if you will, relate to pelvis. So you can also end up having some pelvic dysfunctions as well. And that symptom-wise could feel like low back pain, which we talked about stuff with the bladder can also cause some low back pain. And then the intestinal tract can cause some abdominal pain, which again could also be mimicking from pelvic dysfunction as well. And then we also talk about here upper cervical and thoracic, cervical being meaning your neck. So the upper cervical misalignments is an issue for the very similar reason to the temporal bulge, because of its close proximity to the brain and to the higher functioning nervous system, also the vagus nerve. And then the thoracic misalignments because of your flight-fight system in your body is housed in that mid-back area in part. And so we want to make sure that there's no misalignment in the thoracic area, because that in turn can also have an effect on those adrenals. And like we talked about before, your adrenal glands are really closely related into allergic reactions as well. And lastly, some other things that we would want to look at and evaluate for to help with some of your allergic reactions is some biochemistry, some good vitamins and nutrients that can be really helpful in combating against those allergy patterns that we talked about. Obviously, when we're talking about the gut and gut health, we can't not we can't ignore probiotics. We want to make sure that there's enough good gut bacteria in your body, which helps produce a lot of your immune function. Then we talked about the HCl, that's your hydrochloric acid, that's your stomach acid. We talked about that already. Calcium is important for histamine production. So sometimes you do want the histamine because if you are trying to fight off something that is negative for your body, you do want to be able to fight it off. So calcium would be very beneficial for that. Zinc is an overall immune booster and nervous system booster as well. It really works in a lot of different functions within the body. Quercetin is one that you're starting to hear a lot more buzz about because of the coronavirus. The quercetin is really huge in immune boosting. And it also can work as an antiviral just for the sake of the coronavirus. But when we're dealing with allergies, it does inhibit histamine, and it can also decrease the pro-inflammatory markers. So anything that will cause the inflammation, it can help decrease and diminish that as well. And just for the sake of reference, quercetin can be naturally found in things like onions and some herbs and some berries as well. So, a good proper diet, you'll start having some of these vitamins and minerals easily on hand. Bromelain is another good one. That one's commonly found in pineapple. That one is also really good as an anti-inflammatory, just like your omega-3 fatty acids are also very anti-inflammatory. Just a little tidbit for you, if you will, for the bromelain and the pineapple. There is some within the flesh of the pineapple, but a lot of it is going to be in the core. So you may not want to, next time you chop up a pineapple, you may want to save the core and not throw it away, because you could maybe steep it and make a tea out of it or diffuse it in a water or something like that, so you can get the full range effect of that pineapple. And then we also already talked about the importance of vitamin D when we were talking about the certain demographics that are commonly affected by allergies. So with that, I want to thank you all for listening to this lecture and learning more about how allergies work and what we can do naturally to help combat them or completely eliminate allergies. Typically, when you first come into the office for an initial exam, you would get an orthopedic, neurological, and applied kinesiological exam all in that first day, where we're just doing a whole bunch of data collection on you, getting your history, figuring out really what's that root cause of driving you for whatever the issue is, if it's not allergies or even if it is allergies. And on that second day, there's a complimentary report of findings consultation, and that's when we go through everything that we found on that first day, and I let you know what I found and what can be done to fix it, and then I'll give you that overall the guidance of what I would recommend for treatment based off of what we found on that initial visit. Typically, all that together is usually $225 exam for those 2-day appointments combined. But when we do these lectures, we end up working with an organization called Caring for Others. It's a 501c3 charity organization that helps provide natural and holistic health care for those individuals who simply can't afford any kind of health care. CFO also helps give scholarships to those individuals who like to pursue further education in natural holistic health care. And then they also help provide some funding to allow us to continue to give back to the community and educate the general population about what holistic health care is. And so I mentioned that that initial new patient exam, that 2-day exam and consultation is typically $225. But if you were to call the office and make a donation of $99 to Caring for Others, you'll actually receive that initial exam and complimentary consultation free of charge for you with that donation of $99. So again, I want to thank you guys for listening to this lecture. And if you guys do have any questions about allergies or any other healthcare concerns you guys may have, definitely reach out to me or call the office and reach out to me, and I'll be happy to answer any of the questions you guys may have. Stay safe out there, and we love you guys.